Hey everyone, and welcome back to the channel. Today we're going to talk about something that's often part of celebrations, social gatherings, and winding down after a long day: alcohol. But we're going to look at it from an angle that isn't discussed nearly enough: its direct link to cancer. You've probably heard about dry January, and you've definitely seen the explosion of non-alcoholic beers, wines, and spirits on the market. It seems like more and more people are rethinking their relationship with alcohol, which is fantastic. We know it can impact our physical and mental health in many ways, but one of the most serious effects, and one that's been flying under the radar, is its role as a cause of cancer. Let's be crystal clear: can alcohol cause cancer? The answer from scientists and health organizations worldwide is a resounding yes. The International Agency for Research on Cancer classifies all alcoholic beverages, that's beer, wine, and liquor, as known human carcinogens. That puts it in the same category as things like tobacco and asbestos. A recent study estimated that alcohol consumption is responsible for about 20,000 cancer-related deaths in the US every single year. Now, you might be thinking, if this is so serious, why don't more people know about it? And you'd be right to ask. Our national survey found that over half of American adults are completely unaware of the connection. What's even more concerning is that about 10% of people surveyed actually believed that wine reduces cancer risk. Let me debunk that right now. It doesn't. No type of alcohol is good for preventing cancer. The evidence is so strong that in 2025, the US Surgeon General recommended adding health warning labels about cancer risk to all alcoholic beverages. It's a bit surprising this isn't common knowledge, especially with how heavily alcohol is marketed and glamorized in our culture. So, the next logical question is, how much does alcohol actually raise your risk? Well, it depends on two main things: how much you drink and the type of cancer. For example, the National Cancer Institute reports that even light drinking, that's 1 drink or less per day, can raise the risk of a common type of esophageal cancer by 30%. For heavy drinkers, that risk skyrockets to 400%. The more you drink, the higher the risk. It's a classic dose-response relationship. But how does a simple drink do so much damage? Researchers have a few strong theories. One of the main ones involves a chemical your body produces when it breaks down alcohol, called acetaldehyde. This chemical is a well-known toxin that damages your DNA. Think of your body as having a team of tiny repair workers who fix this DNA damage. When you drink occasionally, they can usually keep up. But when you drink consistently, you're creating so much damage that your repair team gets overwhelmed. The damaged cells can then start to grow out of control, which is how cancer starts. Another factor is that alcohol can interfere with your body's ability to absorb essential nutrients that help protect against cancer, like folate and vitamins A, C, D, and E. Plus, alcohol is high in calories, which can contribute to weight gain. Having overweight or obesity is another major risk factor for several types of cancer. And if you smoke, the combination is especially dangerous. Alcohol acts as a solvent, making it easier for the harmful chemicals in tobacco to penetrate the cells lining your mouth and throat, dramatically increasing your cancer risk compared to just smoking or drinking alone. So what specific cancers are we talking about? The evidence is strongest for 7 types. These are cancers of the mouth, throat, including the pharynx and larynx or voice box, the esophagus, the liver, the colon and rectum, and for women, the breast. For breast cancer, even small amounts of alcohol can increase risk because it can raise estrogen levels, a hormone linked to breast cancer development. Now, what if someone has already been diagnosed with cancer? Does drinking alcohol make things worse? Unfortunately, yes. Consuming alcohol during cancer treatment can actually make some treatments less effective and can cause more severe side effects. This is particularly critical for liver cancer. Your liver is the primary organ for processing alcohol. If it's already battling cancer, drinking puts immense strain on the remaining healthy cells and can limit your treatment options. And for the millions of cancer survivors out there, there's evidence that continued drinking can increase the risk of the cancer coming back, or even developing a completely new, second cancer. Despite this, a large study found that nearly 80% of cancer survivors continue to drink. As we get better at treating cancer and more people survive, living a healthy lifestyle afterward becomes incredibly important, and that includes seriously limiting alcohol. So what's the good news in all of this? The good news is that you can lower your risk. Quitting alcohol is one of the best things you can do for your health. Now, it won't erase your risk overnight, especially if you've been a long-term heavy drinker. It can take many years for your risk to drop to the level of someone who never drank. But the moment you stop, you prevent your risk from climbing any higher. And over time, that risk does go down. This brings us to the ultimate question. Is there a safe amount of alcohol to drink when it comes to cancer? The official dietary guidelines for Americans suggest limiting intake to no more than 1 drink per day for women and 2 for men. But when we're talking strictly about cancer prevention, the most honest answer is that there is no safe amount. Every drink increases your risk, even if it's just a little. The best advice is to drink as little as possible. If you can stick to 1 or 2 drinks per week at the absolute most, that's a great goal. And with all the amazing non-alcoholic options available today, swapping out your usual drink has never been easier. I know this can feel overwhelming, and some people might feel a sense of cancer fatalism, like it's inevitable and there's nothing they can do. But that couldn't be further from the truth. Experts believe that up to half of all cancers are preventable. Knowing that should empower you, giving you a sense of control over your own health. Alongside reducing alcohol, the most impactful steps you can take are eating a healthy diet, maintaining a healthy weight, and not smoking. If you're struggling with alcohol use or are just sober curious and want to cut back, please talk to your doctor. They can provide support and resources to help you reduce your intake and, in turn, reduce your cancer risk. Thank you so much for watching and for taking the time to learn about this important topic. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more health content. Stay safe, stay informed, and we'll see you in the next video.